Oh, okay. Well, thank you so much for joining us.
Sure.
So, do you want to start off? I'm Rebecca. And
I'm Emily.
This is Emily. And we have a couple other students here with us.
Yeah, great.
We're interested in hearing you talk. So, I guess just start off with kind of how you ended up where you are. Kind of how your Bucknell experiences led into grad school, what you did in grad school, what your degrees are, and then where you're working now.
Sure. So my name's Dana Rofey, and I'm an assistant professor at the University of Pittsburgh in the School of Medicine, and I spend the majority of my time doing research in pediatric obesity, and then I run the behavioral health arm of our adolescent medicine clinic. And in terms of how I got here, so I obviously majored, not obviously, because I now review applications for our graduate program, and not everyone does, but I majored in psychology at Bucknell. And then I think, my junior year, I went abroad and worked in a psychiatric clinic for the term that I went abroad. And that solidified my interest in the field. And then I know JT is still there, Professor Potasic, because I still keep in touch with him. And he kindly agreed to supervise my honors thesis in psychology. And so I started quite early doing research and doing clinical work as well. And then in terms, I'm trying to answer all of your questions, so remind me if I forgot anything. So I was in a unique position then, my senior year at Bucknell, to apply straight to PhD programs, thanks to JT and my clinical rotation abroad. And so I think I applied to somewhere between 7 and 11, and I think I got interviews at maybe 3/4 of the ones that I applied to. And then I decided on the University of Cincinnati because there was a faculty member there doing research in the area that I was interested in.
Great. So what about your career now? What does your daily work life look like?
Yeah, so that's what's really exciting, is that while I do quite a bit of research, I also do clinical work. My favorite thing to do in my position is that I supervise not only undergrads, but also, graduate students, medical fellows, postdoc, PhD students. And I run my own research lab called the Pittsburgh Obesity, Weight, and emotion research. So I do research, clinical work, teaching, and supervision.
Wow.
Keeps it fresh.
Yeah. So what would you say is your favorite part of your job? I know you just listed so many different things that you do, but is there anything that you're particularly passionate about and just love to do?
Yeah, so I think my favorite part is supervising students. I absolutely love to see my undergrads get into really competitive graduate programs. I love to see my psychology PhD students get matched to internships that are at their top choice. I love seeing postdocs who far surpass me in their career expectations and goals. So I'd say supervising and mentoring. Mentoring is a really important part. I always feel like I have to pay it forward.
Yeah.
And you chose the PhD route. So what made you choose that versus a master's program where you could have done kind of some counseling work or whatever? What drew you to the PhD?
Sure. So it was pretty clear for me, because I wanted to do clinical research, that I would need to get some research training. So that was a pretty clear path for me. But in terms of advising my students now, I certainly bring up, LPCs and MSWs and different programs that weren't, or PsyDs even, that weren't in existence or as popular when I was going to graduate school.
And is there any advice you would give to current Bucknell psychology majors who maybe are unsure of what they want to do with their psychology degree, or just are like confused about maybe what direction there is or anything like that?
Yeah, I think getting some hands-on experience can really solidify your decision. And you guys are really lucky, as was I, to get an awesome liberal arts education and to have access to professors. So I'm now at a very large in comparison school where you have to really seek out attention from professors. So at Bucknell, I had a really easy time, talking with JT, talking with Professor, Potasic or Boyatzis or whoever sort of in terms of my areas of interest match. And so I would say, get some research experience. And when I say that to my students, they're like, well, I'm taking your class. It's a research methods class. Doesn't that mean that it's really going to be what I'm doing now? And the answer is no. You want to actually help someone do research, not serve as a research participant and not do a paper in a research methods class, but actually get into the trenches and really understand what it's all about. I think research sounds more intimidating than it is. And for me, I always wanted to help people, and so I didn't really understand there was sort of a mismatch between wanting to help people and doing research. And so I do all clinical applied clinical intervention research. So I'm actually helping people but doing research while I'm doing it. So that would be my first point of advice, is to talk with your professors. Don't feel as though you're imposing. Be assertive. Be empowered. And then the second is, using your summers or using your abroad experience to get some more hands-on clinical experience, because these programs are really competitive, and so you want to set yourself, just like you did getting into Bucknell, you want to set yourself apart from the peers that will be applying the same round. So things like volunteering at a children's hospital if you want to go the child route, or volunteering at a psychiatric institute if you think you want to work with severe mental illness. Even things that feel sort of menial. I remember one summer I was doing brochures for a bariatric surgery program. And while I was doing it, it felt a little undermining, but now I work with those people and I do research with them. So finding an area that you're really interested in and doing absolutely everything and anything that you can to get hands-on experience.
And did you have a prior job before this one right now, or is this what you've been doing post-PhD?
Yep, I've been stuck here for years. So that's the other point of advice, is you guys are still pretty early, but you want to go to, I always tell people, do your pre-doc internship, which is your last year before you get your PhD. It's mandatory for a clinical PhD. And for a PsyD, do your internship at a place where you could see yourself working, because that has the highest yield rate of turning into a job. And so I did my pre-doc internship at Children's and the VA because I wanted to be both child and adult, and then I've stayed on ever since then. And there are pros and cons to being a faculty member where you were a postdoc. Certainly I'm just now getting my promotion packet together, and perhaps, if circumstances were different, I would have had to move forward quicker, or, family circumstances or something like that. But I've been in this job for almost 10 years now.
Oh, wow.
Great. Do you guys have any questions? I have a question. What does your research focus on specifically in terms of obesity, pediatric obesity?
Sure. So I'm very interested in interregulatory processes. And so in doing a lot of clinical intervention work, it became quite apparent to me that just telling people what to eat and how to exercise was not enough to change their behavior. And so my specific area of interest is how mood, weight, and sleep interact. And for decades, we've been excluding obese kids who are also depressed from our trials. And the theory is, obviously, if we're having a hard time helping somebody who isn't depressed lose weight, the theory thus far has been that it would be even harder to help someone with, depressive disorder or obstructive sleep apnea. But my research grants show differently. It shows that if you get people at the right window of opportunity, it actually is a little bit more encouraging. So if we think about it in really realistic terms, and you go back to your learning and behavior class, which I still to this day draw upon, you know, you're behaviorally activating somebody who's depressed by encouraging them to be physically active. And so when they do that, and we now have data showing that it makes them feel more positive than their non-depressed counterparts, then that's really reinforcing. So I'm really interested in pediatric and adolescent obesity and how interregulatory processes work in a synergistic way.
Interesting. I don't know that we really have any more questions for you. Is there anything you feel like you wanted to talk about that you didn't get to share?
Yeah, I mean, I think you guys sort of, you know, exemplify the fact that you can be interested in more than one field and make a really clear-cut story about it. So, for example, at Pitt, we have a program where many speech pathologists come and train with us as developmental and behavioral folks to learn how to best help your patient. And so if you can find an adequate joint program, which exists in virtually every field that you guys are explaining being interested in, you can really fulfill your goals in a more broad brushstroke. And so I think that that's, you know, a point of advice is never compromise. I think that when we're going to apply for PhD programs, as a sophomore, you have lots of time, but as a senior, you know, I think we're forced to be specific, and sometimes being specific comes at the cost of being really interested in broad or interdisciplinary kinds of questions. And one of the most rewarding parts of my job is that I've really worked in a lot of health-based settings, so I'm a health psychologist as well. So I'm one of the few psychologists in a medical children's hospital, and even within the division of psychiatry. I'm sort of one of the few that, you know, studies like medical diagnoses. So I do a lot with like polycystic ovary syndrome or diabetes, and how you can sort of, you know, use your area of expertise to bridge gaps among different disciplines, which you guys are the perfect example of. So stay true to your interests, because it's a very long haul and it can be quite arduous.
And did you do any like extracurricular things at Bucknell other than research that helped shape your interests?
Yeah, actually, so I played soccer, and that's sort of where this whole mind-body interest came in, is, you know, how could some of the best athletes, you know, physically not be the best once you're on the field or playing Army or Navy or different Patriot League games. So that's how this all came about, with eating and wellness and physical activity. And then other extracurricular activities I did, I was in a sorority, I was a Kappa. I did some things for the newspaper. I don't even remember what it was called. What's it called now?
The Bucknellian.
Yep, still the Bucknellian. What else did I do? Those were my big ones. Soccer took up a lot of my time.
Yeah,
I'm sure.
Okay.
All right. Well, thank you so much for joining us. Sorry about the little bit of technical difficulties that we had.
No worries. As long as I just wanted to get it done before my next person came in. I didn't want to cheat you guys of time. So let me know if I can be helpful.
Well, thank you so much. We really appreciate your time.
Yeah, take care.
Thank you.
Bye-bye.
Bye.